So the first thing to say is that it is National Volunteers Week, and this is really important. Volunteers make a massive impact and contribution to the workings of our trust and our organisation across all our different services. They're a vital sort of cog, if you like, that can often go unnoticed and unrecognised, and it's really important that we do say thank you for what you do, thank you for how you contribute, both in helping patients and service users, but also supporting our staff to provide the great services that they do. So thank you, and watch out on social media for some updates on the week, both locally and nationally. The second one is just a heads up in terms of recognising great staff and teamwork, is the Oscars, annual celebration of again great work across the organisation. This year, like no other, has seen a massive increase in the number of nominations, and we've got the awards ceremony on the 10th of June. So again, look out in our media and comms pieces for your peers and people you've nominated, and give the winners a big clap on the 10th of June. And those sorts of things are really heartening to read, because it just underlines the fantastic work and the extra steps that people go to provide great services. So another brilliant piece coming up. And then in terms of recognition updates, to let everybody know that we're a national winner. So earlier in the week we heard that we had won a national award from the Dental Awards. So our oral health promotion team, also known as the Tooth Fairies, won a national award for the best National Smile Month initiative. This is amazing, not only because they're probably the tiniest team in Tiny Town in the organisation, consisting of, as far as I'm aware, less than 2 people, or more than 1, 2 whole times, and to carry out that promotional work across the whole county is a phenomenal achievement, and to get recognised for it is fab. So well done them. More other sort of things to sort of, I'm sure is in your consciousness, but just to sort of reiterate, really, we're continuing, aren't we, to make some good progress out of the pandemic. You'll be as familiar with the numbers as I am nationally, in terms of concerns about the overall number of cases with regard to the Indian variants going up, and some real hot spots across the country. As of recently, not within the county of Notts, but very close eyes are being kept, particularly with regard to Nottingham City. But there's other data, in particular the hospital admission rate and number of deaths is fortunately staying stable and not increasing. And there are a couple of the indicators that will inform the government's decision on the 21st of June to make those final steps out of lockdown. Obviously, there's a lot of time between now and then, and a lot of data to crunch. I think before the final decision's made. But there's a couple of bottom lines. One is it seems to be increasingly apparent that the vaccines, if you have both vaccines, you give yourselves maximum chance to be immunised against contracting the virus. So we're continuing to encourage and urge all our staff to avail themselves of the opportunity to get vaccinated. And again, I know I repeat myself, but just say you've not missed any cohort deadline or age group deadline. If you were waiting for a bit more time to see how it was going, or you weren't sure, do ask. We've got lots of expertise within the organisation to help make a decision. and we'll continue to encourage you to do that. And the second thing, if Anne-Marie was here, I'm sure she'd be saying too, despite the fact that you may have had both vaccines and are now likely to be immune, it's really important that we continue to practice good IPC behaviours around social distancing, being in ventilated spaces, wearing a mask, washing our hands, etc., etc. And we'll continue to do that whilst we're instructed to do so by the experts. And we appreciate and know that it can be frustrating and challenging to continue to do that through long shifts, in busy and demanding ward environments particularly. But we're really grateful for you to continue to carry out those behaviours. As soon as we're able to relax that, we'll obviously let you know what the process will be around it. We'll continue to be at 0 outbreaks across the organisation, so it's been that now for a number of weeks, which again is really heartening to hear, and a testament to the work that people are putting in for us to stay off that particular radar. So again, thank you for that. And we're continuing to pick up the threads of getting back to some of the way services were looking before the pandemic, but it's not going to be the same. And we've had quite a long conversation with the executive team this morning about what do we actually mean by a mixed economy of working from home, coming into work, what are workspaces, shared workspaces going to look like? And that's a really detailed piece of work, because teams are different, locations are different, and we need to make sure that we get it right. And one of the things we have agreed is that the really important component to that is to make sure that we engage with staff groups about what good would look like in terms of our workspaces for a return. So again, watch out for the opportunity to contribute to that discussion and debate over coming weeks. I think probably, Yolanda, that's as much by way of introduction to kick us off with. Please feel free to put questions in the chat and we'll respond if we can. If we can't today, we'll get a response to you. So over to you to guide us through what the questions that we do have, Yolanda. Thanks.
Thank you, John. The first question is quite detailed and quite technical and a bit clinical for me. So I'm going to hand over straight back to you, John, to ask you if you would just sum up the question and the response, trying to remember that this is a general conversation with staff that are clinical and non-clinical. Thank you, John.
Yeah, thanks. So as Yolanda says, there's quite a bit of content within it and quite a lot of specific clinical questions with regard to, as a trust, how we treat and care for our patients, particularly patients with mental health and learning disabilities. I'm going to kick off, and then Julie is going to come perhaps with a bit more detail about the significant increases in funding we are in the process of receiving, which hopefully will address some of these concerns. So the first line of the question is that a community support worker would like the point of institutional, I can't even say it, institutional honesty discussed in particular. And then there's 2 paragraphs of concerns that I suppose what we call the medical model still dominates, that we continue to use antipsychotic medication, we continue to detain people under the Mental Health Act, use community treatment orders, and that these are obviously a very significant infringement on people's civil liberties. And that I'm sort of paraphrasing here, that if there were sufficiently funded alternatives to this, such as additional talking treatments, psychological interventions, and more trauma-informed care, etc., that we wouldn't need to do the former, and that we're only doing the former because there's a deficit in funding. So two bits then. So from an institutional honesty perspective, you know, again, this notwithstanding the content of this question, I think it's a really important part of our value base, isn't it, to be trustworthy, to be honest. And I would say, you know, having worked in mental health for more years than I care to remember, 30 plus, that I think it's a truism to say that historically that mental health and disability services have been underfunded and under-resourced compared with physical health services, and that's been consistent. But over the last year, I'm now having to sort of moderate that response a bit, because I think some of the national strategic work, the national team have argued and presented their case consistently to Department of Health and to the Treasury. Has actually secured a very significant increase in funding, which we are starting to see come down to, without sticking too hard to the side of commissioning organisations to fund the sort of things that would add quality value to the services that we provide, in the sorts of vein that the questioner is getting at. It's clearly not a cure-all for all the concerns we have, but it's a really important start. So in terms of, yes, we are up for honest conversations about what we can and can't do, what's the best evidence for things, and I hope this is an example of us doing that. But I'm going to hand over to Julie for a bit more specifics on, okay, there's a bit of money coming, so what sort of things are we able to invest in? Julie, thank you.
Yeah, so I think, you know, just to start by acknowledging some of the constraints that we have been operating within, you know, capacity, workforce, weights. Some of our pathways don't do what patients necessarily need them to do in the right way, and that makes it hard for clinicians to offer a broad range of choice, I think, due to some of the reasons that John's outlined. So I think, you know, we're quite transparent. Well, we are not quite transparent. I'm particularly transparent about, you know, what that means in reality. And just to cover some of the things that we have started to do to try and address some of the issues about delivery. So the last sort of year, 18 months has been about bolstering crisis services to make them core fidelity compliant. So that means running at the appropriate level, being able to pick up people quickly in a crisis, being accessible 24 hours a day to people of all ages. We've also put quite a lot of bolstering into the early intervention in psychosis team, which has quite considerably grown in the last year. And we've put in, I think it's 70 staff last financial year into the LMHTs. Now, that's just a trickle, I suppose, in terms of what's coming, and some of that we pump primed ahead of sort of national funding. What's happening this year is it's actually a very considerable investment. So it's over £16 million into the main mental health pathways. So that's for children and young people, perinatal, the homeless, and a lot of the bulk of it is into the largest group, which is for those with severe mental illness. So we're going to see a transition in terms of what we can deliver. And we've started to build a new pathway for people with personality disorder. It's following along with psychosis, and we're doing a lot of work actually around physical health care. From this year, there'll also be some mental health capacity going into primary care. so that people on the sort of mild to moderate end of the people that we see are supported in primary care and less likely to need specialist services. And there'll be an expansion of IAPT as well. That's improving access to psychological therapies. So people will have a much broader range of access. And what that means for us, probably in the first wave, is roughly about 300 more staff into children and young people, and particularly into community, what we sort of traditionally think as local mental health. And on top of that is investment into the third sector to help us provide some of the stabilisation interventions that people are currently waiting for. So there's going to be quite a shift. The challenges for us are around the workforce and getting, people skilled in the right sort of care delivery that we need to be providing. So, a greater range of workers with a greater range of skills, hopefully managed in a way that's much more accessible, and then also bolstered by a lot of third sector capacity. So I think if we can do those things, there will be a broader provision of psychological support in addition to the medical interventions that people do need as well. So there'll be a much more broader range of access and offers. That's the anticipation.
Thank you, Julie. There's also a comment and a question from Hanny, which, if you're still happy to sit in the seat, Julie, he's asking about team building and can teams be encouraged to go for away days and any other suggested ways of team building?
Yeah, I mean, that's a good question, Hanny. We are encouraging that. I know several teams I've seen some things on Twitter about teams have had that time out. I think I will acknowledge where we've been in the last few months, and it's been really challenging. I would see that sort of activity starting to increase over the next couple of quarters, and maybe, after summer and into autumn, teams will have a lot more opportunities to do that. It's really important for people to have that time together, just to focus on, where they need to go, whether it's embedding the values or, the clinical changes that we're trying to make. It's really important. So, yes, we would encourage it. And if people find difficulty arranging it, if they could just let us know, and we can try and support that in different ways, because I realise some teams that are small and specialists can struggle, but we'll do our best to help, most certainly.
Thank you, Julie. A really comprehensive answer. And Hanny's also put thank you in the chat. So thank you, Hanny, for joining in. The next question, John, is for you, and it's been reported in the media over the last few days that the vaccines minister has said that they're considering compulsory vaccination for health and social workers, including medical staff. And he's just asking what the trust view is on that.
Yeah, thanks, Yolanda. And the other bit in the question was it's already mandatory for surgeons to be vaccinated for hepatitis B. What's the trust view? I suppose the bottom line is that irrespective of what view the trust has, it will be not be a decision that we will make. At the moment, the national guidance and instruction is that the vaccine is not mandated. And as I was saying earlier, we're encouraging and persuading all our staff to get vaccinated, because we think on the best evidence we have, it's the right thing to do. We appreciate there are different views, which is good, and we appreciate that it's a choice. And that situation will continue to pertain until or if a decision is made nationally to make them compulsory. I suspect, so that's the fact bit. The next bit is supposition. I suspect there's some quite heated debates going on in the national teams around this. and strong views on either side saying you've got to make it mandatory, get on with it, what you're doing, versus, you know, it's going pretty well at the moment, let's continue on this tack, with the expectation that, you know, as months pass, the overall percentage rates will continue to increase. I think one of the things that will inform that debate is how things go with this Indian variant over the next few weeks and months. And if it stays, inverted commas, relatively contained, then they might stay on this tack. And if it really starts to move into a wave that where the rates start to ramp up, and they might change the perspective. Like I say, that's just my sort of interpretation of it. But the bottom line is that we'll be instructed one way or the other, and if it becomes mandated, we will be very, very tightly held to account to make sure that we're doing what we're told to do. Personally, I hope it doesn't come to that, because I think we have made fantastic progress, both within our organisation, but also within the broader system within the county. You know, we've had some great fora where you know, we've shared the learning, enabled people to ask questions, and get up to speed on it. Personally, I think that's the best way to do it, but it may be something that's taken out of our hands.
Okay, just sticking with that, John, Hanny's put a question in: would staff have a choice of which type of vaccine they can have?
Yeah, that's a good question, Hanny, actually. Yeah, so again, I probably need to double check my facts on this, but I think at the moment there is an element of choice, but I'd need to get back to you to confirm exactly how that works.
Okay, thank you, John. And the next couple of questions I'm going to put towards Jen Guiver, who's the Deputy Director of People. Oh yes, there you are, Jen. I was getting a little bit worried that I couldn't see you. Jen, before I ask you the question that you've come on to answer, I noticed that you put something in the chat about away days and the support of the OD team. Would you just like to run through that for those that are present, please?
Yeah, so our OD team has been pretty much redeployed to the pandemic response, but we're now getting the team back, which is absolutely fantastic. And they're a group of people who have experience in organisational development, and they could offer leaders some advice on what a team timeout might look like. They'll have experienced lots of examples of those over their careers. They'll just be able to give you some ideas around if it more of a form of setting an agenda or contacts for external venues, obviously all in line with social distancing and PPE requirements. So contact is Alex Lyon, who's on leave at the moment, but back next week.
Thank you for that, Jen. So keeping you in the hot seat, the question is, there's been a suggestion that people who are on the old 1995 NHS pension scheme who were forced to move to the 2015 scheme might be able to move back to the 1995 one. Please, can you confirm if this is the case, and please give details?
Okay, so I'll start by saying I am not a pensions expert, and I shouldn't be offering any pensions advice to anyone. So you must access your own pensions financial advisor for anything specifically about your pension, because obviously it can have big impacts. But yes, it is true. People remember in 2015, the government made changes to public sector pensions in general. So not just the NHS pension, but across the public sector. There's been a legal case that has gone through, which was led by some firefighters, which essentially has deemed some of the decision making that happened in that 2015 change to be unfair from an age discrimination perspective. It's quite complicated. It very much depends on your personal circumstances, but there is information on the NHS pensions website about that. Which I think the best thing for me to do is put the link to that in the chat. and then advise you if you think it affects yourself to contact pensions for a discussion.
Thank you, Jen. That's really, really helpful. And then sticking with you, there's been quite a detailed and specific question about flexible working, which I shared with you earlier, but actually I think that more benefit would be gained if you could just comment in general terms about flexible working and the trust stance and how people access flexible working. If you wouldn't mind taking that question, Jen, thank you.
So the question was about someone's specific request for flexible working that had been declined by the manager. So I was just going to comment generally on our flexible working guidelines. So appreciate, and this year more than ever, we've seen how people have had to flex home and work life, and it's really important that we get that balance right. The Trust has a flexible working guidance document, which is available on Connect. Again, I'll put the link in once I've stopped speaking so people can access that directly. That, in summary, allows anyone in the Trust who's been with us for 6 months or more to put in a formal request for flexible working, and there's a form in that guidance that you fill in. That goes to your manager. And as you'd expect, your manager then needs to look at how that will fit with pressures on the rest of the team, patient care, the hours of the service, other requests that may be in place for other staff, and then either accept that or decline it. The guidance is really clear that decline should be a discussion. So it might be the case of, oh, you can't have every Monday off, but what about another option? If the member of staff and the manager can't reach a conclusion amicably, there is an appeals procedure to that. But I would just urge people, when they want to work flexibly, to really think through their requests. And often if you fill in the request thinking about both your personal circumstances but also how your team works, it's more likely to be accepted because you've kind of done some of that thinking through yourself. So I say I'll put the link to the guidance in the chat.
Thanks, Jen, that's really helpful. I think that's brought us to the end, John, of our questions and comments that have been submitted. Can I hand back over to you to sum up and maybe give a little mention about Volunteers Week and Carers Week, please, if that's okay, John?
I will do. Let's just show you weren't listening at the start, because I've mentioned Volunteers Week already.
Sorry, John. I was busy writing my notes for this session. I do apologise, boss.
See me after.
Happy laugh anyway.
You never listen to a word I say.
Try not to.
Good. No, thank you ever so much. Good session. Some really good questions. Some really important questions too. I hope we've been able to cover most of them off. Like I said, I'll get back to you. We'll respond next time to get a bit more clarity about the choice aspect of vaccines that you raised, Hanny. But no, to finish with a thank you to everybody for all that you're doing. As Judy sort of implied a few minutes ago, it's been really tough. Some of the services within the organisation have been at their busiest in the last few months. Can you compare with the whole of the pandemic? And I suspect as well we're not through the last of that yet, as things continue to sort of ramp up in a number of sectors. So lots to do, but at the same time, make sure that you look after yourselves and that you look after your teams. Team away days, a great idea, and as we've said, we really support those. There's lots of additional support as well through the health and wellbeing services that Tracy Yolanda is overseeing with her team. So avail yourselves of that, detail on Connect too. So as ever, thanks very much. Good session. And just to finish, remind everybody it's National Volunteer Week this week. Is that right, Yolanda? And next week it's National Carers Week. Have a good afternoon, everybody.
Thanks, everyone.
Cheers.